This is how to get help. This is Gail Kenner. She is with the Allegany County Health Department, and I'm just going to let you introduce yourself and talk about your program a little bit here.
My name is Gail. I'm from the Allegany County Health Department. It's the Administrative Care Coordination Unit.
That's a mouthful.
Yeah, where we just say ACCU. We help people who have Maryland Medicaid. So any problem they might have, they can call us. We find that people have benefits. They don't understand their benefits. They don't know where to go for help when they have a problem with their benefits. And lots of times they call the number on their back of their card. They're not getting the answers they need. So we are available for anybody who needs help.
A lot of people don't understand the word Medicaid. They do understand state insurance, and they also know if they have an insurance company like Maryland Physicians Care, Aetna Better Health of Maryland, WellPoint, Priority Partners, and Care First Community Plan. So I just want to throw that out there to people that Medicaid is also all those other things.
Right. We try to explain it as Medicaid is like the big umbrella, or Maryland Medical Assistance is the big umbrella. And under that umbrella, you have different benefits. Some of those benefits might come from your managed care organization, like WellPoint, or Aetna, Maryland Physicians Care, and they could come from Maryland Healthy Smiles for dental. So we try to explain it that Maryland Medicaid or medical assistance is just the big umbrella, and under that are all these other little benefits that they have.
When should somebody call you?
Anytime they might have a problem with their insurance. We find that a lot of people, they might go to the pharmacy and the pharmacist is telling them that their benefits aren't active. They can call us and we'll look into that. A lot of times it's an easy fix, but they just need to know where to call. They can call us just for general information. We also, while we're talking to people, we do tell them about other resources in the area. We just kind of try to determine what else they might need. So we talk to them about other health department programs or social needs, transportation, if they need help with housing or food or anything like that. So it's kind of, once we get them on the line, we not only help them with Maryland Medical Assistance or their state insurance, we just help them with anything that we might come across in the conversation.
Now, if someone's having trouble finding a doctor to take their insurance, can they call you?
Oh, absolutely. That's a big part of what we do. Staff in our office, they keep up-to-date lists of all the area doctors, even doctors in other counties. We update that quarterly. So every few months, our office reaches out to the providers. They find out if they're accepting the insurance, which managed care organizations like Maryland Physicians Care, Aetna, they determine what types of those that they take. They talk to the dental providers, any specialists. So we have quite a long list of doctors. So anytime somebody calls in, we can send them in the right direction so that they're not trying to call providers on their own.
Now, we're going to have this information in the description for the video when it goes up, but what's the phone number?
301-759-5094.
One of the things that I run into a lot, and I don't know if you do or not, is people call us about a child, a grandchild, a close friend, some relative, and they want to know what kind of help is available.
Oh, absolutely. Yeah, if we can't help them, we'll find somebody who can. We can't share private information, and people will call us and be concerned about a medical issue for someone and they need help. We can't even share with them that they have Maryland Medical Assistance, but we can give them general information and try to head them in the right direction.
Now, I was looking on your website and I saw this thing called Ombudsman.
I'm the official ombudsman for the county. And I'll back that up a little bit. Every county in the state has an administrative care coordination unit. And then within that unit, we have an ombudsman. That ombudsman will assist people who have called the state's complaint resolution unit with a complaint about their insurance. Might be something simple, but if it comes through the complaint resolution unit, they will act on that very quickly, and then they will eventually filter that back to the county in which that resident lives. Then we help that person find a doctor or get them back into care, or do whatever it takes to get them what they need.
When are you guys open?
We're open daily, Monday through Friday, 8 till 4:30.
Should people call before they walk in the door, or can they just walk in the door and ask for help?
Oh, absolutely. They can walk in the door. We like to see people face to face
Okay.
because then we can give them the resources
Right then and there.
We do a lot of education with pregnant and postpartum women. That's another part of our job. And when we do that, we tell people, if you do have a problem, call the local ACCU. We are local. We know our local resources. We know we have right next door is the eligibility office at the health department. We work hand in hand with them, making sure that people's benefits don't run out, or they don't have a lapse in their benefits. So it's a group effort.
Again, what's that phone number?
301-759-5094.
Gail, I want to just thank you for coming and taking the time to talk to us today.
Thanks for having me.